I'm Mark Seddon. I've been the UN correspondent for Al Jazeera and subsequently have worked for the UN Secretary General Ban Ki-moon and President of the General Assembly, Maria Fernanda Espinosa. And with all the logistical and political challenges faced by Palestinians, we want to explore how the people of Gaza and the West Bank are coping at this unprecedented time, and of course Palestinians who are in refugee camps and also Palestinians in Israel itself. Medical supplies were already scarce, as we know. Movement has already been terribly restricted. And what we'd like to hear from our expert panelists today is what the situation, for those who are based in the occupied territories, we would like to hear from them on the situation that is happening right now. And they really do seem to demand a coordinated global response to the health and economic crisis that has now enveloped the whole world. But instead, we seem to be seeing a mixed and sometimes fairly erratic response. And it kind of varies from country to country. And in this early stage of the pandemic, there seem to be varying degrees of success in countering it. And a lot of the media has been focused, especially the Western media, rather predictably, on what is happening in Europe and in North America. And there's been very limited reporting and debate around the impact of the pandemic and what its effects are, could be, especially in the global South. And of course, the reason really for hosting this program today, this discussion today, is for us to focus on the situation in the Palestinian territories. And that's what we'd like to focus on now. And without further ado, I'd like to begin really by turning to Steve Sosebee to ask you, looking at, I mean, the WHO publishes a daily report on the pandemic and as it's beginning to play out in the occupied territories. And I think actually we just referred to the second death that has just taken place. But as of yesterday, I was reading that I think there's something like 250 odd cases of COVID-19 on the West Bank and a further 13 in the Gaza Strip. All of these are WHO figures. Very possibly there could be rather more. And the Ministry of Health is reporting that many of these newly reported cases were amongst Palestinian workers who had come from a factory. They're working in a factory in Atarot, if I've got the pronunciation of right, and where they've been in conflict and contact with where they've been in contact with a confirmed case from Israel. So I wonder if I could start by asking you, you know, you're there, you can see what's happening on the ground. What is the current situation in Ramallah and occupied East Jerusalem and the West Bank from your vantage point? How are things beginning to play out on the ground?
Well, thank you for inviting me in. Thank you for giving us an opportunity to present the situation here in Palestine and in the Middle East in general to a wider audience. Here in Ramallah, where I live, they closed down over a month ago, closed the schools, and restaurants came afterwards, gathering places, companies, organizations were no longer able to open and function as they were before. They started that very early here, decision by the Prime Minister, and was actually the right move. Everybody now applauds it and can see that it has had a positive impact in mitigating the spread of COVID here in Palestine. But to answer your question, things have been shut down here for the most part. People are still able to go out if they need to, but there isn't really anything to go out to. Everything is closed. The weather isn't very good these days, so this helps to keep people indoors and keep the social distancing policy in place here and effective. But for the and I've traveled around. Last week I was in Tulkarm and Jenin and Nablus for reasons to monitor and to implement humanitarian projects in the field. And you can see the Palestinians are taking this issue quite seriously. I passed through at least 12 different checkpoints of Palestinians, did not see a single Israeli checkpoint. Even the DCO checkpoint here in Ramallah, which they control very stridently out of the northern entrance to the town, there was no Israeli soldiers around, but it was heavily manned and monitored for humanitarian and for medical purposes by the Palestinian security forces. And they were doing that in the entrance of Jenin, Nablus, Tulkarm, and on the roads connecting the towns as well. So they're taking it quite seriously for good reason, because we know the real battle is to prevent rather than to deal with the spread and the large-scale infection, which everyone fears here in Palestine would be devastating to the health sector and to the society in general.
And Steve, what about Palestinians who still might still be able to travel to work in Israel proper from the West Bank? What's happening there?
I really don't know much about that subject. Maybe another panelist might. I don't believe that the borders, I know it's actually Passover holiday in Israel now, or has been, so I don't think the borders are open. They probably close the West Bank as they usually do during this time, even more strident than usual. And I don't believe workers are going from the West Bank into Israel. We're getting a lot of workers back. And you mentioned before, about 1/3 of all infections here in Palestine, recorded infections, are from workers returning from Israel, where there are over 7,000 current COVID cases.
And are you able to tell us anything about food supplies, basic necessities, their availability?
Yeah, the local market still has these available, and we've been procuring them and distributing them to a lot of at-risk people, retirement homes where people are isolated and at the most at risk to the COVID infection, to refugee camps, to poor areas where a significant number of Palestinians live day to day, live hand to mouth, and losing their income, losing the ability to make wages, has impacted on a humanitarian scale here the entire population, and people are going without food, going without the basic necessities, and we're trying to mitigate that as well.
And finally, for the time being, Steve, with you, I mean, looking at those WHO figures, it does seem that, I mean, it seems to be a similarity almost wherever you look at, but the majority of cases seem to be male, but also younger. So far, the infection rate seems to be stronger amongst younger males. But what about children? What sort of restrictions? I mean, have there been school closures? What's the situation on the ground with schools?
Yeah, the schools closed in early March, and daycares, nurseries, kindergartens, playgrounds, everything has been closed for over a month here. I have 2 children who are in daycare and school here in Ramallah, and they've not been in school for over a month. So as I mentioned before, the government took early action and very strict action to try to stave off a large-scale infection.
Thank you. Mohammed Omer, if I might turn to you in Amman in Jordan, I mean, we're receiving very little information really on the situation in Jordan and amongst the Palestinian population in that country. What is the situation there? And can Palestinian families still do any traveling or to the occupied territories, or has all of that as travel between Jordan and other parts of the Middle East been closed off too? We may have lost Mohammed there. I don't know, Mohammed, can you hear me?
Yes, well, I hear you.
Oh, you can. There you are. Fantastic. Now, I don't know. Did you hear my question?
I heard your question. Yes. No, the situation right now in Amman, it's a military curfew. The border is closed. The airport is closed. The movement of Palestinians into the Palestinian side to the West Bank is also not possible, given that the Kingdom of Jordan is on a full lockdown at this moment. So the movement is difficult. Today in the Palestinian refugee camps, there is a random testing for about 300 to 400 people in Jordan, as I understood from government officials. And this is taking place in the refugee camps. So this is a good step moving forward to ensure that the camps are safe and they can control the spread of the virus in case of any spread in there. Overall, Jordan is really maintaining the situation quite well and mitigating it. We are seeing more and more steps taken by the government to control the virus. Some of the measures and the steps have been quite strict, but I would say so far it's been under control as opposed to many other countries in the Arab region.
Mohammed, in the camps you just referred to then, I mean, 300 to 400 people a day is obviously a very, very low number of people. Hopefully this is going to be ramped up. This seems to be a common problem right across the world, this lack of preparedness. What about, have you any sort of reports, any idea of how well equipped health workers are in the camps? Have they got the protective equipment that they all say that they need?
Well, in the camps, they don't have much of equipments. The equipments are mostly available in key hospitals in Jordan. These are the ones that provide the medical supplies. There are 5 or 6 hospitals that are operating. They are specialized on cases for testing COVID-19. So I'm not sure if they will have much of equipment available at this stage. But I'm quite confident that Jordan is pretty much controlling the pandemic in Jordan. Within the next 2 to 3 days, we are going to receive more reports out of the Palestinian camps, but I'm quite confident that the government in Jordan, together with the Ministry of Health and WHO, are doing the very best they can to ensure that the COVID-19 does not get into the Palestinian camps.
I wonder if I can quickly turn also to the situation in Gaza. Obviously, you're not there, but I mean, this is where you were born, where you were raised, you worked, your family's been. You wrote quite a powerful report on the situation in Gaza just the other day for the Washington Report on Middle East Affairs. And anybody watching this, please do look at that piece by Mohammed. But I wonder if you could give us an idea of what the situation could be if this COVID-19 begins to spread in Gaza, which for people watching this will know Gaza is essentially locked down, closed off, and the health facilities are very, very poor in the Gaza.
Mark, I want to take a moment to address the resilience of the doctors, the nurses, and the caregivers who are responding to COVID-19 in the Gaza Strip. They are doing an incredible job under their situations. But let me also give you 3 facts about Gaza as of today, which are really important to understand how Gaza is responding to COVID-19. First, the absence of enough ventilators is particularly worrisome in the Gaza Strip. There are only 60 ventilators in the Gaza Strip for all medical emergencies for the population of 2 million people. That's quite alarming. The other fact which you may not heard is that in Gaza you may have electricity for a ventilation, but you do not have electricity to light a surgery room. That's another bizarre reality in the Gaza Strip. Another fact, we all know that Gaza has been on a lockdown, and many Palestinians, when you tell them lockdown, especially Palestinians who are living in Europe, they say lockdown. It sounds familiar like a curfew in the Palestinian territories. So Gaza, which has been under blockade for the last 14 years, is today exporting masks to Israel. As factory workers that have been laid off work for nearly 14 years in the Gaza Strip, today they were able to operate again and to switch production from clothes to protective masks and other medical supplies. Today they were able to send from Gaza 10,000 masks that are made in Gaza. Tomorrow they are going to be producing another 10,000. And I know that the Israeli market, also the West Bank market, and now they're saying they want to open the chance for them to export to Europe as well.
Well, there we have it. Breaking news, actually. I mean, that is quite extraordinary. I haven't seen that being reported or picked up anywhere. Hopefully it will be. Look, thanks very much for the time being, Mohammed. I'm now going to turn to Jonathan Cook, who is joining us as we said earlier from Nazareth. I mean, Jonathan, within Israel itself. What is the situation with the Palestinian communities there? I mean, are Palestinians being treated equally as with Israeli citizens? I mean, how is it how is it working? They're all citizens, it is said, of Israel proper. So are Palestinians living within Israel being treated the same?
Well, people like me have been arguing for some time that Palestinians inside Israel are living in highly segregated society. I've used the term apartheid for a variety of apartheid specific to Israel to describe the situation of Palestinians living in Israel. They're a fifth of the population. And here you see it, I think, illustrated quite well, because one of the strange things about Israel is that we've got a large number of Palestinian citizens of Israel who are operating in medical fields. A fifth of all doctors in Israel are Palestinian citizens. They're a third of the nursing population. Half the pharmacists in Israel are Palestinian citizens. So they're really on the front line dealing with this health crisis. And yet at the same time, they're being entirely marginalized in terms of testing, in terms of protective equipment, in terms of access to hospitals, only because of very pressure that's coming from the Joint List, which is the political party that represents Palestinians in the Knesset, in the Israeli parliament. They've been putting a lot of pressure on the government to provide testing. We now have a couple of testing stations, one in the north, one down in the south for the Bedouin. But those are very recently established. Before that, there were hardly any tests being done. So there's really no clear picture of what the situation for Palestinians is like. At the moment, 3% of COVID-19 cases, there are 3% of Palestinians who are included in the figures. It's now just reached 10,000 inside Israel. So they're a very tiny proportion, but we don't know if that's actually the situation or not, because we haven't had the testing done. It may be far higher. So that's possibly a contagion that's coming. We won't know until people start dying from the disease what the true situation is in Palestinian communities. Given that so many Palestinian, there are so many Palestinian doctors inside Israel, they're exposed to the virus. So one can only assume that they're going to bring it back into Palestinian communities, exposing the rest of the population. But there's very little capacity for dealing with that. One of the other problems we're facing here is that the Israeli ambulance service, Magen David Adom, isn't mostly operating in Palestinian communities. They're the ones who are doing the testing. They're the ones who know how to evacuate people. They've got the protective equipment and so on. But they're not operating in Palestinian communities. We mostly have private ambulances that work here who are not equipped to deal with this. So if people need evacuating, they need taking to hospital. We're actually got a crisis there too. So in many different ways, Palestinians inside Israel are quite exposed at the moment. There's a lot of concern about it. The Palestinian community is far poorer than the Jewish community. There's the healthcare situation is much worse. Overcrowding is much worse. There are many Palestinians have chronic health conditions because of the kind of lives they lead, because of the employment situation. Many work in casual labor. Many are now unemployed. About a quarter of the population inside Israel at the moment are unemployed. The Palestinian community, because so many are casual laborers, they're more exposed to these problems. They don't have, they're not necessarily eligible for unemployment benefits and so on. So there's a great deal of concern, economic and health concerns here. I'm talking mainly, I'm based in Nazareth in the north, where we're in a better position than the Palestinians living down in the south. The Bedouin, particularly the Bedouin communities down in the south, in the Nakab, in the Negev. There are about 100,000 Bedouin who are living in unrecognized villages. They don't have access to electricity, to water. They're very exposed to this situation. Again, the ambulance services aren't there. They don't have health clinics. They have no primary sources of healthcare. So at the moment, doesn't seem to be too much of a problem because they're very isolated, most of these communities. But at the same time, Israel is carrying on its policies of demolishing houses in the unrecognized.
Well, that's what I was going to come on to ask you about, actually, Jonathan. You know, politics doesn't stand still. There will be all sorts of politicians in any situation trying to take political advantage of situations. And I'm just wondering, you know, where does all of this leave the domestic political crisis that's been bubbling along in Israel itself? I mean, where does this all leave these plans for further illegal annexation and for the Trump deal of the century?
Well, we've seen Gantz caving into Netanyahu and agreeing to join a government with him, a national emergency government to deal with the virus. In doing so, he's pretty much destroyed the opposition to Netanyahu, which was based on the whole principle that Netanyahu wouldn't be in a position to form a new government. In doing that, Gantz has destroyed his own section of what people are calling the centre-left. I tend to resist using that terminology. I don't think it's a centre or a left, but that opposition to Netanyahu has sort of crumbled in the face of Gantz's submission to Netanyahu on this point. Now we're seeing Netanyahu. Well, the one thing they have agreed is that they agreed on annexation. Both sides in this emergency government, if it emerges, they are supporting annexation. Now it seems that Netanyahu's thinking about pulling out of this, withdrawing his offer to Gantz, because Gantz has destroyed his own support. So it may be that Netanyahu can manage to get his own government without support from Gantz. But either way, whether Gantz is in the government or not, everybody's still talking about annexation. So that it seems to be full steam ahead. And the fear is that while we're all locked down, I mean, I know this is a general problem throughout the world. There are increasingly draconian laws being imposed everywhere. Governments are taking advantage of this kind of crisis. But here we've got a particularly dangerous situation where you have Palestinians who have no representation in the Knesset and occupied territories where Israel really has a free hand. And given that there's political consensus now, the worry is that Netanyahu will use this opportunity, the fact that everybody's locked down, the fact that the international community's attention is turned elsewhere at the moment, as an opportunity to push ahead, even more intensify the whole annexation process.
Thank you, Jonathan. I'm just going to turn to Yara Hawari. I mean, Yara, following on from what Jonathan was saying, I mean, the actual reality on the ground is still a very distinct advantages and disadvantages for some, and yet there's been a lot of kind of there's been some discussion in various media about Israeli and Palestinian cooperation, whatever this might mean. So I'm just curious, as I'm sure lots of other people will be, is to know what is this cooperation that is being talked about? I mean, how does it really manifest itself? Is it frankly realistic? And given from what Jonathan and others of you have been saying, it's actually the cooperation seems to be that which is already existing on the ground with doctors and medics who are Palestinians, but not much more beyond that.
Yeah, and thank you for bringing up this incredibly important point. I would say that the Israeli regime is using this global crisis not only to distract from its ongoing violations of human rights and from the really violent manifestations of occupation, but also as a political tool to gain diplomatic leverage. And we've seen multiple international bodies commending Israel for its cooperation with the PA, the Palestinian Authority, during this crisis. Actually, the UN Special Coordinator for the Middle East peace process, and there is still such a thing, Nikolai Mladenov, called the coordination excellent in a recent speech. Now, in reality, what this coordination or this cooperation is basically COGAT, which is the Israeli coordination of government activities in the territories, or as it's so called by Israel itself, allowing a minimal number of internationally donated medical supplies to reach the West Bank and Gaza, as was a shipment from the WHO of 3,000 tests and 50,000 masks, a very, very tiny number, well, far below the actual needs of the West Bank and Gaza. So, in effect, the Israeli regime, which is maintaining this violent military occupation and has totally depleted the capabilities of the Palestinian healthcare system, is being praised for allowing in tidbits of medical supplies from international actors, despite its responsibility under international law as an occupying power to provide the supplies itself. And so that's why I think it's incredibly important that, you know, international actors not only support vital humanitarian efforts on the ground for immediate medical relief, but they also insist on Israel's responsibility as the occupying power to foot the bill for the Palestinian medical needs themselves. And I think it's also incredibly important that we shift this narrative from cooperation to highlight Israel rather, or the Israeli occupation, as an instrument of comorbidity. And by comorbidity, I mean, in other words, not only does the occupation exacerbate the conditions for Palestinians to be susceptible to infection, but it's also directly responsible for those conditions. And that's why I think it's incredibly disingenuous to argue that now is the time for cooperation, you know, and or dialogue between Israel and the Palestinian authorities to confront the pandemic. And if I may just provide perhaps an analogy that sort of makes this a bit clearer. Imagine a situation of domestic abuse between two partners, with partner A physically and mentally abusing partner B within a quarantined household, and you tell partner B to forget about that abuse that partner A is still taking part in during the quarantine, and to work together to fight COVID-19. And that's what the international community is doing. It is conveniently ignoring that the occupation is ongoing, and that the cooperation, the so-called cooperation between the Israeli authorities and the Palestinian authorities is a positive thing or a new thing, and is perhaps a sign of hope, when in actual fact, it's not that at all. And they're really doing the minimum that is required of them via international law. And when you consider that Israel controls all the borders, everything that comes in and out of the West Bank and Gaza, of course the PA has to talk to Israel to get the bare minimum needs. Of course that dialogue has to happen.
This is, I mean, maybe this is a bit of a hard one to ask of any of you, really, but you've all focused on it. And essentially that because of the focus of this pandemic as it moves around the world, and the media attention and the political attention, and how at present, you know, particularly in the Palestinian occupied territories, it's not up there as a priority, as a story, if you like. I mean, how and what pressure needs to be brought to try and get a focus on to these issues you've been raising, essentially this abusive relationship that you've compared to a household, which would be quite familiar, unfortunately, from all of us who are following this.
Yeah, absolutely. And I think the main problem is that there really isn't a political will anymore to sort of stand up for Palestinian rights, especially in the international arena, especially from the European community, which is sort of being shoved out of the process by the US. So there is a real desperation to hold on to anything, as we saw with Mladenov holding on to this sort of commending this excellent coordination. It comes from a politics of desperation and not one of hope. And it's also one that's demonstrated when people talk about Gantz as perhaps saving grace in all of this. And it's absolutely ridiculous that Europeans and international actors would consider Benny Gantz any kind of partner for peace, as they would call it, when he has multiple times said that annexation is part of his political mandate, and actually said that it was plagiarized, that Benjamin Netanyahu plagiarized the idea of annexation for him. So it's absolutely ridiculous, but I think it's very demonstrative of desperation by international political actors. And I think the key thing that third-party and international actors need to focus on is securing and guaranteeing Palestinian rights and leaving the politics for the Palestinian people, because that is not happening. And you cannot ask a people that are being abused and occupied and dominated to sit at a table with their abusers when they are constantly being oppressed and being forced under this kind of domination.
Thank you, Yara. Turning, if I might, to you, Chris, also in Britain. I mean, Yara was talking about the EU effectively being pushed to the one side by the US, and essentially, in many ways, we have seen not only the EU but the UN and all the international institutions, if you like, partially marginalised by the agenda, the political agenda that's been driven by the US and Israeli administrations. I mean, given where this focus is on, I mean, we're talking about the effects of the pandemic today and how this could play out in the longer term. I mean, how, and the sheer difficulty really at the moment of getting people to focus on the occupied territories in Palestine. What pressures could be put on the EU and also the British government, in particular the British government, to make a stand on some of these issues?
Well, thank you, Mark, and thank you for those who put this together. And I would like to echo what Mohammed said earlier on about the fantastic, brave and brilliant people who've been on the front line of this in Palestine and in other countries that are conflict-ridden. And by way of context, we've learned today that there's been the first case in Yemen as well, another conflict-ridden state, and one where we also fear that the virus could spread rather rapidly in a devastating fashion. I think really when I think of the international role and the European role in this COVID-19 pandemic, it's not our failure in the last couple of weeks that is troubling. It's our failure over 70 years plus that has led to all of this. We haven't necessarily done anything specifically wrong as an international community, in March, but it's the fact we failed to challenge the occupation, the barriers, the wall, the imprisonment without trial, the detention of minors, all the blockades and barriers, the home demolitions that are continuing to go on. The fact we have not said anything about this in the past means that Palestine, as a small country in the Mediterranean, which should have been perhaps facing a crisis akin to what Jordan or Tunisia is facing a possible catastrophic crisis, because it comes on top of, as Yara is outlining so wonderfully, the occupation and the blockade of Gaza, of course. So it's that historic failure that means that Palestinians are more likely right now to suffer more in this outbreak than others. The Europeans, yes, they've been marginalized, and much of that is because of their own weakness. The European Union, its failure to adhere to the basic norms of international law, the perpetual failure to hold Israel accountable for anything. And one remembers going back to 2009 that the only thing that the Israeli authorities did in terms of accountability was to penalize a soldier for the misuse of a Palestinian credit card. And that's pretty much sums it all up. And we have seen this absolute historic failure to challenge Israel on the way it treats Palestinians, both inside Israel, and Jonathan was outlining that, within the occupied territories. And we've seen quite similar things in the past before. Remember, if you go back to 2003, that there were legal cases trying to get the Israelis to provide for gas masks then because of the threat potentially from Saddam Hussein's Iraq, or indeed the absence of enough shelters in the Palestinian communities within Israel, let alone the occupied territories, to protect people from rockets that were coming from Lebanon. So there's been plenty of other opportunities in the past where the international community could have stood firm on the need for Israel to treat everybody equally, but it doesn't. And it really points to that failure to say to Israel, you are the occupying power. You actually have 14 million people that is under your jurisdiction that you are responsible for, and you must deliver aid regardless of ethnicity, nationality, etc. You are responsible under Article 56 of the Fourth Geneva Convention in the event of epidemics such as this. But we don't do it. And I don't think we're going to see it now, of course, because, and let's burst that arrogant bubble that we have sometimes in the so-called developed rich world. We are failing to deal with this crisis. We certainly are in Britain. It's not looking great in the United States. So if we can't deal with it, how are we expecting Palestinians who have no better than semi-autonomous control to handle this?
Chris, I mean, interesting from what you're saying, and also taking the having a historical perspective, and trying to get governments and institutions to face up to their legal responsibilities. But you do begin to wonder. I mean, this is a conversation that we've all been having, and this pandemic is already throwing up huge social divisions and showing these inequalities on a vast scale, whether that be between different boroughs in New York City or in countries in the global south where there is injustice and division. And you just wonder whether really, we can't really look into a crystal ball. We don't know where all of this is going to be ending in 12 months, 18 months or whatever, and what the world might look like. But you do wonder whether people at the end of all of this in the occupied territories and outside, having experienced what people are about to experience, are going to be putting up with all of this, or indeed allowing this kind of unilateralist approach by different governments, such as the United States government, for instance. I mean, I put to you essentially, do you not think that the multilateral global response to a global pandemic, both in terms of the medical and economic response, is going to have to be much sharper and more focused at the end of all of this? And it might actually happen?
Without question, and arguably we could have had, through real, genuine international cooperation, a much better, prompter, more efficient response to this pandemic. And you can lay the blame of that at all sorts of countries, those countries that haven't been honest with the statistics. The official figures suggest that in the Middle East that roughly about 4,500 people have died so tragically as a result of this virus, but we just cannot trust those figures. But we also can't trust the figures in China and other countries. So many countries have been navel-gazing in terms of their response, and they are not looking out for the broader human need globally. And this isn't going to be just an issue for Palestinians. I think we're going to see similar sorts of reactions in Syria and Iraq and other countries in the region who see this extraordinary gap between the rich and the poor, the have and the have-nots, those people who can buy face masks. In Gaza, hardly anyone can afford to buy a face mask. People are going to buy not packets of paracetamol, but single pills of paracetamol. And that have and have not is been seen already in all these protests that we have seen. People thought that the 2011 protests had dried up. Well, last year we saw many from Sudan, Algeria, Iraq, Lebanon, other countries. There is widespread anxiety, anger that is out there. And I suspect once the pandemic and the lockdowns have been lifted, that is going to be expressed in a pretty forthright fashion, to say the least.
Thank you very much, Chris. Yara Asi, if I could also go to you, and thank you for being so patient. In fact, thank you to all of you for being so patient. But could I ask you? I mean, we saw what happened with the budget cuts to UNRWA, United Nations Relief and Works Agency in Palestine. We also saw over the past 18 months other member states of the UN stepping up to at least plug some of the gap. We're now, of course, seeing threats. We don't know whether they're going to be carried out or not, again, by President Trump to budgets of the World Health Organization. Now, of course, these may not feed in immediately, but the question is for Palestinians who do look to some of these UN organizations, such as UNICEF, such as UNRWA, such as WHO, have these organizations been already weakened? And if you're able to tell us anything about all of this, I mean, how are you seeing them cooperating and being effective on the ground right now?
Yeah, absolutely. First off, thank you, Mark, for the question. Thank you for having me. I think we have to look at this long term, right? So COVID is exposing these inequalities, as so many others have said, but the problem is that these inequalities have existed, and these aid agencies, although their work is vital and truly Palestinian health, education, sanitation, all of these efforts would be significantly worse if not for this work on the ground. The purpose of aid long term should be getting the target population to no longer need aid. The fact that the UNRWA, which, yes, was tasked with taking care of the Palestinian refugees 70 years ago, it's now taking care of their children and grandchildren. Well, yes, we want to bolster them. We want to provide them funding. We want to help them do that work on the ground. But what we really need to do is deal with the structural issue that causes so many Palestinians to be dependent on these organizations for services that most of us receive by the state. It's not sustainable to have a refugee population for what will soon be a century that's still stateless in many of the states where it lives. As we've heard, the refugee camps within the West Bank, within Lebanon, throughout the Middle East are very poorly served. The United States has taken, the UNRWA has taken a huge hit because of budget cuts from the United States, primarily. Yes, we have seen Qatar and India and Russia and China filling in these gaps, but in 5 years, when the next crisis hits, or 10 or 15, who is it going to be? It's simply not sustainable to keep relying on international actors and aid agencies. What we're seeing here is that public health needs a long-term vision. We can't just be dealing with vaccination efforts, dealing with trauma patients in Gaza. Yes, that is needed. But if you're going to have a sustainable health system, you need to be thinking of 5, 10, 15 years. And Palestinians, they don't know what their territory will look like in that time. They don't know what their budget will look like in that time. They don't know what the state of all these aid agencies and even of their primarily donors will be in that time. So they can't plan. So they're just constantly putting out fires. And I mean, I don't want to at all say that these aid agencies are not vital. I want to emphasize that. But the purpose should be state building, building infrastructure within the state so that Palestinians can take care of Palestinians and Palestinian institutions on Palestinian land. And we are only getting further from that. So we're only increasing the dependence on these aid agencies, and they will continue to be stressed as climate change, the next pandemic, whatever happens next happens.
Well, thanks, Yara. I mean, that's it's a gloomy view, but rooted in reality, of course.
Yeah.
But I mean, what I'd like to do, if I may, is ask you, and then to go and ask every one of you, really. We've actually gone beyond the immediate pandemic issue. We covered a whole range of economic and political issues as well, and tried to look to a degree at a crystal ball and try and also to come up with some positive suggestions and actions. There's a kind of and actually, before I do that, and ask all of you, I'm going to ask you, Yara, and then go to Aseel. If you had one demand of international institutions, what would that be? And also, if you had one demand not one demand, a request for people who might be watching this and wanting to get involved, what can they do to get things moving on COVID-19 specifically in Palestine?
Right. I would say the demand is quite easy because there is already international humanitarian law that's on the books that deals with all the issues we're talking about. My demand would be, let's adhere to what we've already agreed should be the standards for human rights in the world. We are so selective in who we choose to punish, who we choose to target. The coziness of the United States with the King of Saudi Arabia, considering all the human rights violations there, the absolute unwillingness to just say basic facts about what's happening on the ground in the West Bank and Gaza, as though any criticism of Israel is somehow inherently wrong. These rules are written. You can go, dissertations, books, chapters have been written about all of these. What we need to do is enforce them. And then my request would just be to donate to some of those organizations on the ground that we will certainly hear about, some of whom are representatives here today. And if you live in a developed country where you have the energy and time to contact your representatives and demand, that we adhere to the human rights standards that many of us in developed nations take for granted, I think that our voices are very powerful right now in this moment.
Thank you very much, Yara. Aseel, thank you very, very much for waiting. And really, I wanted to turn to you and to ask, from your vantage point, what is needed right now in the Palestinian territories in terms of medical equipment? What shortages are there? What needs to be done? What needs to be happening now?
Yeah, first of all, let me start to say that Palestine has a special context due to their living conditions. Like there is an alarming lack of equipment, personal protective equipment, local shortages, and compounded by the long-term restrictions imposed by the Israeli blockade. So we have lack of infrastructure, essential equipment, and drugs and supplies in human resources. And in medical aid for Palestinians, we're focusing now on preventative measures. So for example, in Gaza, we're trying to supply the quarantine centers with hygiene kits, supply the drug store with protective equipment for the health workers. And we're trying also to try all the preventative measures until now, and then to hopefully not to reach this point, to try and supply the Ministry of Health with all the medications needed if the disease spreaded. So what we're trying to do now is prioritizing infection, prevention and control, and we're trying at the same time to just prevent the disaster from happening.
Aseel, I mean, Mohammed told us earlier about in Gaza the production now of masks and actually being sent to Israel. I mean, we've obviously had the broader critique of cooperation where it's kind of been politicized, but there's obviously independent cooperation of sorts going on. So we understand that there's some Israeli companies that have been involved in producing testing kits. I mean, is that the case? Is that true? Are these being made available, or are they just being kept within Israel itself?
I won't be able to answer regarding Israel, but I know that 3 days ago, the Ministry of Health in Gaza made an announcement saying that they are entirely out of testing kits, and they only have 78 intensive care beds and 63 ventilators, and they have zero stock of disposals and essential medicines. So whatever is being produced in Israel is not reaching to the West Bank and Gaza, for our knowledge right now. And also for the West Bank, they have been called by WHO to provide urgently testing kits because they're running out of them very soon.
So Aseel, on that, I mean, for people out there who would like to help, how do they get in touch with you? What should they be doing if they can make some financial donation and support for the equipment that's needed?
In the beginning of this month, we launched an emergency appeal. So if they can go to our website, to the Medical Aid for Palestinians website, they can donate through our emergency appeal on Facebook or on the website. So they can help us to provide all the protective equipment, material, and the hygiene kits for Palestinians in Gaza and the West Bank.
Well, thank you very, very much indeed. I'm just going to briefly go back to the rest of you, if I may, and then we'll have to bring this to an end. But I just briefly to you, Steve, that question that I put. That question I put essentially about what, if you had, with the 2 points. One is what you want the international community to do, and two, specifically, what can we as individuals do? We've just heard about how we can support medical aid to Palestine, but if you have some suggestions on that front, please let us know.
Yeah, on the first point, first of all of the speakers, and I think they outlined pretty clearly that the main issue that we face here is not just COVID, but the bigger crisis of occupation and the policies of the Israeli government towards the Palestinians, particularly in the health sector, and all sectors. I can't say particularly in the health sector, but it's most obvious in the health sector today because that's where the biggest crisis that the Palestinians are facing with trying to deal with and have to survive this global pandemic. And doing so under occupation, I just want to give my deep respect and admiration to the Palestinian people all over, not just inside Palestine, but in the camps in Lebanon and Jordan, Syria, and wherever, for staying so humane and keeping humanity. I live here as an American. My government, my country's policies towards Palestine have historically been detrimental and destructive to the whole Palestinian cause on the most basic level. I live here with pure kindness from the entire Palestinian people. And I think that element of humanity needs to be acknowledged and respected. I can't necessarily say that would be the same for my American people if we were subjected to the kind of treatment that the Palestinians have been, and to have somebody who represents that by nationality amongst them. So much respect. I'm sorry to make that so long, but I just feel very strongly that the main issue here is the humanity and the dignity of the Palestinians to live free and equal like any other people in the world, and that's being denied, and it's being now we're facing a potential outbreak in a place like Gaza, which is so congested. 70% of the population are refugees from 1948 living in one of the most densely congested places in the world. If this disease takes roots there, it's going to devastate the entire Gaza Strip, even more than it has been. I mean, let's be honest, I go to Gaza, and all of you know very well, Gaza has been devastated many times. The one thing that Gaza has not been is broken from a spirit point of view. The willingness and the desire of the Gaza people to be free remains true as it ever has been. So COVID's not going to destroy that spirit, but it could potentially wreak devastating havoc on the people there. So what we're trying to do as an organization like MAP and like so many others here doing great work, as Yara said, you know, we have to deal with what's happening today. Our organization believes in two things. One is to deal with the urgent needs of the Palestinians, many times dealing with being bombed and shot, but also just living under occupation and having a healthcare that's so affected by the policy of the Israeli government. And the number two thing is we want to build a sustainable health system. We want to lessen the dependence of the Palestinians on external actors to support their health system, particularly the Israeli occupier. So building cancer departments that we've done here in Gaza and in the West Bank for children was not only to help these sick and needy kids get the care that they need, but more importantly, reduce the dependence on the occupier to provide treatment for our children or anybody. And Palestinians should be able to treat their own kids. They have great doctors, they have great institutions. And as Mohammed and others said, much respect to the healthcare workers here as well who are on the front line.
Thank you, Steve. Thank you. In fact, thank you very much for that.
I apologize. Go to PCRF.net. Let me just plug my website. Sorry. You know, you get talking about Palestine and you can't stop. PCRF.net. We are on the ground like MAP, like so many others, providing direct humanitarian aid to people who need it most and supporting the health system here by bringing in equipment and materials. Sorry, guys.
Thank you, Steve. No, you're quite welcome. And Mohammed, if you're still with us from Amman in Jordan, are you still there with us, Mohammed?
Yes.
Mohammed, so the same question to you. I mean, this is, hopefully people are listening. The international community, what would you want them to do to help step up politically, economically to this pandemic crisis afflicting Palestinians as everybody else, but particularly severely now? And also, do you have a request for people watching this, taking part? You know, what can they do as individuals?
I think back to what Yara has said already, really is the international community has to insist that Gaza should be free, to open the borders, to allow people, well, to open the borders during pandemic is another question, but to give the chance for Palestinians to live and, you know, to live in dignity according to international law. The best way I would say to support the Palestinians is through UNRWA. There is already an appeal that's going on. UNRWA has been going through a drastic times due to the cut of aid. I really hope that more people are going to join forces and support UNRWA. MAP UK and Palestine PCRF also are doing incredible jobs. So these are organizations that have a lot of impact on the ground, and I really hope that you guys will contribute and support them.
Thank you, Mohammed, and good luck to you in Jordan. It's great to see you. Jonathan in Nazareth, same questions to you, if you're still with us.
I am.
Excellent.
Well, I'd echo all those things that Mohammed has just said. I wanted to just focus maybe, this is my sphere of interest as a journalist, is dealing with that sort of nitty-gritty, the granular stuff that's going on day to day. And one of the things that small indications of how Israel, its bad faith in this situation, which I think it's worth focusing on, and which the international community could do something to put pressure on Israel to mitigate the kinds of things it's doing. One of the things that strikes me as just obvious, when Israel claims to be cooperating, seeking cooperation, that it's helping Palestinians here, we can just look at one small indicator of their bad faith, which is that Israel created a COVID committee, emergency committee, back in February, and there is not a single Palestinian on that committee. There aren't any Palestinian citizens of Israel on that committee. We have lots of doctors here and so on. None of them have been advisors on this committee, let alone Palestinians in the occupied territories. If Israel really wants to cooperate, if it understands that it's a pandemic, it's a global problem, and it's obviously a regional problem, Israel has to work in cooperation, real cooperation with Palestinians for its own sake, for its own selfish reasons, let alone for the sake of Palestinians. So it ought to be putting Palestinians on those committees, working with them. In Israel, we don't even have information in Arabic about COVID. They're issuing things in Hebrew to the Palestinian population here. They're that far from understanding that this is something they have to work with Palestinians on for their own sake, for their own selfish reasons, if nothing else. Another issue which I think is very important and which needs highlighting is that Palestinian workers who are coming into Israel have been contributing a part of their salary or their pay to a sick fund. And they've been doing it for a long time, and it's accumulated into a very large sum of money, $150 million worth of funds. And Israel is holding on to that money. It makes it almost impossible for Palestinians to claim that money. Now is the time to release that money. There have been demands on Israel. People have been requesting they release that money. There's really no excuse when Palestinians now cannot work, when they're trapped in the West Bank, when families are struggling to put food on the table, that Israel can't release that money, which is their money. Those Palestinian workers earn that money. It belongs to them, and they need it now. So just in very small ways, Israel needs to be held to account, and pressure can be put on Israel by the European Union, by America, just in these small ways. I'll leave other people to deal with the bigger picture, but in these small ways, it's quite possible to put pressure on Israel, but nobody's doing it.
Thank you very much indeed, Jonathan. And now to you, Yara Hawari, what would be your wishes?
I would second everything that my colleagues and comrades have said, especially with regards to humanitarian efforts. But I think it's important that we don't let Israel use this as diplomatic leverage, and that we seriously refute this notion of cooperation, which is not even meeting the bare minimum of international law. But also importantly to recognize Israel as an instrument of comorbidity, being not only exacerbating conditions for infection, but also being directly responsible for them. And just a final point to mention, Palestinians are resisting and are, continually trying to challenge the pandemic themselves, but these efforts are also being disrupted by the Israeli authorities. And something we didn't mention was that the Israeli authorities destroyed a COVID-19 clinic that was being set up in the Jordan Valley. The Israeli authorities also arrested activists in East Jerusalem, Palestinian activists who were attempting to help vulnerable families in East Jerusalem who didn't have enough food, and they arrested them. So there are efforts that Palestinian efforts that are attempting to deal with the pandemic, and they are being directly disrupted by the Israeli occupation regime. And so I think it's very important that we highlight that this is not a situation of cooperation, it's a situation of occupy and occupied.
Thank you, Yara, thank you. And Chris Doyle, if you're still with us there in London, what would you like to add?
Well, it's hard to add to all the excellent suggestions that have already been made by my colleagues. But I think when I look at the role of the international community here, I think that they must make sure that they hold Israel to account, has been said, but they also ensure that it is widely understood that the best way for this pandemic to be dealt with is that there is true and genuine cooperation, that Israel does have to undo its illegal activities. It may not be able to open up Gaza for full traffic, as Mohammed has suggested, but it could at least allow volunteer medical personnel in, for absolute free flow of all necessary medical equipment, the necessary funds and so forth. There's much that Israel could be made to do within that. And I think as a donor community, we need to make sure that our political leaders understand that actually, at a time of great donor fatigue, when there are all sorts of other crises across the world and our economies are going into free fall as well, that if we really want to save money and get value for money, then we have to step up to the plate politically to demand that Israel does remove the impediments to proper healthcare, that it does allow that free travel of patients and medical personnel and everything else we've all talked about, because otherwise we'll be throwing hundreds of millions, billions again down the drain just to keep this existing unsustainable situation in place even during such a pandemic. and to ensure that under the cover of this horrific pandemic, Israel doesn't exploit it to even restrict further Palestinian human rights, to even advance further the Trump plan in the way that it's doing in Jerusalem at the moment by excluding areas such as Kafr Aqab and Shuafat refugee camp, and that it doesn't also try to enlarge its authoritarian powers. We haven't even mentioned that rather dodgy app that is called, was it the Coordinator, where they track you and everything else, and they're trying to make Palestinian workers in Israel use this app, which has in its sort of footnotes basically saying, you know, we're allowed to even use this for security purposes as well. So I think there's so much the international community do that would be in the international community's interests, let alone Palestinian. Thank you very much, everyone.
That issue there, I mean, we can probably come back to it at another time. It is important. It's something that we did want to talk about. But Yara Asi, moving to you, what's your prescription? Briefly, what would you like the international community to do, and what would you like us as individuals to do too? We all have ways and means of making things happen. What can we do?
Well, I would just reiterate, I mean, we've already agreed globally for decades now what a base acceptance of human rights and should be. And we have almost very rarely held to that accord. I think that, you know, the international community, and even that term, what does that mean anymore, really? But they have thrown billions of dollars at this, I'll say, problem as a shorthand, and demanded almost nothing. I mean, they have built greenhouses and hospitals in Gaza that are just bombed or bulldozed by Israel weeks or months later with a condemnation. It's not just poor for the situation for, of course, the Palestinians on the ground, but it just doesn't make sense. There's limited money, there's limited resources. People, like I heard donor fatigue earlier, you know, look at Syria now, look at Yemen. Now the entire world is going to be going through an economic crisis. It can't just be throw money at the problem and hang on until whoever follows me in power has to deal with it. We've been doing that. It's only getting worse. You know, I don't think anyone has even mentioned two states in this entire hour-and-a-half conversation about Israel and Palestine. That's how impossible that seems at this point. Where would they even be? And yet we still hear very credible, legitimate organizations saying, we condemn any actions that go against the, you know, two-state solution. It's like, are we still doing this? Can we move on and look at the situation on the ground? Without the work of these humanitarian agencies, the situation in the West Bank and Gaza Strip would be 10 times worse. So this is a Band-Aid, but underneath is not a tiny scrape, it's a broken bone. And you need... Not going to work.
Thank you. I mean, essentially, what you're all doing is throwing up more issues that flow from this pandemic in a way, but our chance to try and, in our small way, try and reshape the debate, which we'll hope to do over the coming months. So anyway, last but not least, and it's because you've been so patient, Aseel, I'm going to go to you for your prescription, and then we'll have to bring things to an end.
Yeah, I just want to add a few points that Israel in this year has destroyed 139 structures across the West Bank, including donor-funded humanitarian relief structures and water sanitation. And there have been incidents recorded that they are abandoning Palestinian workers who may have COVID-19 on the checkpoints. So what I'm trying to say is the whole media about the coordination between the PA and Israel is only we call it manipulation, because on the ground we're seeing the complete opposite with the rise of the settler violence and the demolitions. And recently we also heard a lot of incidents about Israeli soldiers, for example, invading Bethlehem and Ramallah cities and using the spitting method, if I may call it, just to terrify people of spreading the virus. So what I'm trying to say is the violations, occupation violations, are still on the ground. They are still increasing, and all we need to do is to put more pressure on Israel as the occupying power to adhere to its duty to the Palestinian people, to at least have the right access to medical access.
Thank you very much, Aseel. And And thank you to all of you as panelists who have joined in from 3 parts of the globe, from the Middle East, from Europe, from North America. This is the first Palestine deep dive of its type. We hope to do more. And we hope this kind of pioneering use of Zoom technology, if you like, is going to start something serious off here. So thank you very much to all of you. Thank you also to the team who have worked so hard to make this happen. And until next time, thank you all for watching.
Thank you.
Thank you so much.
Thanks so much.
Thank you.
Thank you.